Thank you. We're here to talk about getting hot, very, very hot. So thanks to the Conduit today for keeping us nice and cool. And specifically, how it affects our health. And in cities. Cities, partly that's where most people live, but also they're vulnerable to heat in different ways. So we have a panel of experts to cover all bases. First of all, we have Peter BABUDU, who is the Executive Director of Impact on Urban Health. On the screen, we have Francesca Racioppi, who is head of the European Centre for Environment and Health at the World Health Organization, WHO, and she is all things policy. We have DIMPLE RANA, who's an associate at Arup, who you may have heard of. She's our built environment expert, using data to understand the climate and cities. Meet the engineer. We have LINA LIAKOU, who is the global director at the Resilient Cities Network and has been a deputy mayor, so she's actively been involved in making decisions about climate solutions in cities. And we have Jeanette ICKOVICS, who's a professor of social and behavioural science at Yale School of Public Health. She is our academic, and between them, we can take you around the world in solutions. Now, we heard actually from Jamila earlier, the crisis is not one of ignorance, but one of inaction. So to kick off, each panellist is going to help us understand why we need to act now and through a tangible example of their own work. Lina, could you start for us? Thank you.
Sure. Tangible example. So we were doing a workshop in Quezon in the Philippines with students in a school. And there was a student saying, well, when the school closes because it's hot, I go home, which is hotter. Let's not forget that they also go to a house, to their home, without adult supervision, because their parents usually work. So the question here is what it means to have schools that actually are not refuges, are not safe places for our children, and when the alternative, it's actually worse. And what does this mean for their mental health, for their learning, for how their body reacts to the stress? And for me, that's the trigger to actually work on this.
Absolutely. Peter, could you pick up?
Certainly. And so Impact on Health, we're part of Guy's and St Thomas's Foundation, and our focus is on, we're a philanthropic funder, and we try and address the root causes of what make you healthy. And climate represents one of, if not the biggest long-term kind of factor affecting health. Examples, looking at our Guy's and St Thomas's Hospital Trust, which we're based near, if you take your mind back to 2022, when we had a really hot summer, critical IT systems across the trust went down. That meant surgeries being cancelled, and not just that, community practices, GP practice going down as well. The trust had to spend $1.5 million trying to get IT back up. That took weeks, and through that time you were having cancelled operations and much more.
Yeah. Dimple, what example have you come across in your work?
So for me, it's really trying to use data and modelling to bridge that gap between heat perception and the reality. So I think, we've all seen the headlines over the last few weeks. It's summer now in the Northern Hemisphere, and we're seeing increasing number of headlines about record-breaking temperatures, all of these things. But there is still a gap between what people perceive as the risk of heat and the impacts of heat and the reality. And I think what motivates me is with the work that I do, is we look at cities, we look at mapping heat over cities and understanding where are the hotspots, what are those temperatures. Some of the work that we've done has found that sometimes in urban centres, it could be 5, 6, 7 degrees hotter than the temperatures that we measure. And so it's really important to understand where those hotspots are and who they're impacting, because that's really kind of the key here. So with the work that I do, it's we sort of zoom into those things and then look at solutions. So it's that kind of bridging that data gap and bringing that sort of perception to reality.
Yeah, Jeanette, what would you point to illustrate the urgency of the situation we're in?
Thank you, Fiona. Good morning. I want to I think Francesca's going to address some of this as well, but I think a couple of things. First of all, as you mentioned, just in the last few days, this heat wave, somebody said earlier this morning, this heat wave in the UK will kill likely 600 people just over the last few days. And it's not just the immediate risk of, let's say, heat stroke. There are long-term health consequences of profound heat and prolonged heat on the heart, on the lungs, on the brain, on mental health. All of these risks are really profound. And we'll come back to this later, but of course, there are things we can do to mitigate, to adapt, to prevent. What I wanted to do in starting was take a high-level approach and tell you a little bit about some work that Resilient Cities and Yale have done together over the last year. It's a project we call Urban Pulse. I think this will just set the stage a bit because we surveyed nearly 200 city leaders in 118 cities in 52 countries. Let me tell you what they said about heat. More than 70% had a high concern about unpredictable rise in temperature, including even more than that, who were concerned about their impact on vulnerable populations, like children and older adults. And about half increased a high level of concern about outdoor activities, for example, children in schools, labor capacity, and heat-related deaths. Second, more than half, 52%, said they had already had economic losses due to heat. And this was more than than flooding, storms, and air pollution. So the city leaders themselves were more concerned about heat than flooding, storms, and air pollution in terms of the impact on health of their residents. And finally, cities were not as prepared as they should be. About 40% had no climate action plan or resilience plan. And of those that did, only 23% addressed climate and health concurrently. So we'll come back to that. I think the optimist in me says these are all big challenges, and yet they create opportunities for us to act.
So the statistics are pretty stark. And Francesca, what's the view from Europe?
Yes, good morning, and thanks for having me. Sorry for being connected remotely from Bonn. Yesterday we had here our little peak of a heat wave here. But when it comes to Europe, I don't know how much it is common shared knowledge, but in fact we are speaking of the region in the world that is warming up at a much higher pace than any other part of the world, twice as much. And these are the facts. We were just reminded at the beginning of the session that there is an estimate 500,000 of deaths attributable to heat worldwide. Well, Europe has its own fair share, unfortunately, here. And just between 2022 to 2023, we had some 100,000 deaths together, but only in 35 out of the 53 member states of the WHO European region. So it means heat is killing. Heat is killing a lot. Heat is killing particularly in cities. And there is a lot that we can do. And here, allow me to flip the coin on the positive side. What keeps me running and going is that at the WHO here in Europe, we are leading the updates of guidance for the development of heat health action plans, because our organization sits at the intersection between evidence, where evidence is created, and how we can put evidence at the service of member states. We are in the process of updating this guidance that will be released the next year, together with the European Commission. It's a project supported by them. And I'm very happy to say that one of the new items that we're going to have in this guidance is increased attention on cities. And I'm sure that we will come up back to this point as we move through the session, because in cities we have a huge potential to make the right things at the right time and for the right people. And I'll stop here so that we can continue later.
Okay, so I think you're not left in any doubt that the urgency is there, that the need is right now. Lina, what's your statistic of the day?
I'm going to follow up based on what Jeanette mentioned. I'll just say that 4 out of the 10 large cities, only 4 have actually robust early warning systems, which means understanding the risk and having the right protocols and have the communication with the communities, have the integration with the public health systems, and then being able also to respond and recover.
Yeah. Rana, we measure temperature. It's not as simple as we think.
No, absolutely not. So just not a statistic, but just something to think about in terms of what exactly is heat. So we talk about air temperature, we talk about peak temperatures, but in reality, what people really experience when they experience heat is not just the air temperature, but we need to also start being a bit more sophisticated and thinking about the humidity in the air movement, as well as solar radiation. If it's 20 degrees and you've got the sun beaming down on you, you're going to feel a lot warmer. So there are other indices out there to measure heat, but we need to increase that communication and understanding. The other thing is sort of instantaneous heat versus long-term heat. So Jeanette, you already mentioned the long-term effects, but quite often you might be at a moderate temperature, but if it's sort of over a period of 4 or 5 days, that could have a worse health impact. So if you've got 5 days of sleepless nights, that's going to cause mortality, morbidity, all of that. So it's important to think about the long-term effects, not just in a heat wave, but also over many months. If you're in some parts of the world, heat waves and sort of that heat period is getting longer and longer. So if you've got sort of months and months of temperatures not dipping down, again, that's going to have an impact. And then the last thing is really, where do we measure heat? So we talk about sort of temperatures outside in the built environment, which is important, but most of the time we're inside buildings, and most of the time we're inside our homes. Countries like the UK, much of Western Europe, North America, our homes are designed to keep the heat in, and we start seeing excess mortality in the UK when it's 16 degrees. That's not hot. You're wearing a jacket at 16 degrees. But what's actually happening is that when it's 16 degrees outside, in a lot of people's homes, it could be 20 plus degrees inside. And so we need to understand more about what are the internal temperatures that people are actually exposed to when we're seeing some of these health outcomes. Again, coming back to sort of modeling data, we're getting increased amount of data on all of this, so we can start understanding the places that people are actually habiting and having a bit more of a sophisticated conversation.
Well, you were promised solutions. And the good bit is we are here for real-life solutions. I mean, we can practically take you around the world, as you probably picked up a bit already. How many cities, how many countries has your work gone into?
101.
100, well, there we go. That's a pretty good start. So, well, Lina, do you want to start then? You have solutions, you're bursting with solutions. So do you want to kick off with a couple to inspire us?
Sure. And I would like to create, like in our mental mind, like 3 categories. One is governance. What a local authority needs to put in place in order to be able to respond to heat. We see great examples all around the world where cities are appointing chief heat officers, chief resilience officers, like somebody that is able to work across the different departments and agencies. Let's not forget, local government is very siloed, as generally public sector. We are talking about plans and strategies, heat action plans, resilience plans. Then you have the response, how you actually respond before, during. This is the early warning systems. This is the naming the heat waves, which was a campaign. We know Seville did it, which is great. Like, why naming only hurricanes? Like, this creates awareness. This is also around building the right protocols, whether this is, for example, with workers outside, that work outside, with schools, when this needs to be closed, and so on. You have the cooling centers, resilience hubs, with more and more cities creating this type of ad hoc places where communities can go. And then you have the third one, which is the reimagining our cities. Because we need to actually redesign our cities, in order to be able to address and minimize the impact of extreme heat. And this is where we're talking about building codes, right? New materials. This is where we have the transformation of the schoolyards, like the Oasis project in Paris, and then many others have replicated. This is the urban forests that Freetown is put, like the 3 million or 30 million trees until 2050, or Melbourne with their small urban forests. This is around the Cooling Neighborhoods project that, for example, New York is doing. So the issue is that there's no one solution. A city and its ecosystem need to be able to mobilize itself and try to address all three pillars, both how, the timing, like actually responding, and then the long term. Again, our cities need to look different if we want these cities to be livable and healthy.
Jeanette, could you pick up on a couple of those and tell us what they actually mean on the ground? You know, what happens in these kind of cooling areas? Thank you.
I'll give an example, a real practical example, sort of building on Oasis schoolyards, but the idea of these nature-based solutions. But I think also I'm sort of a systems thinker, so building across this panel and then also some of what we heard this morning. So we've got sort of the nature-based solutions like the schoolyards that are not just for schools, but really are community resources. And then tying to what Dimple said about the built environment, we really need to think about how those talk to one another. We go from inside to outside and outside to inside. So we need to be thinking about those together. So I'll give you a specific example. In New Haven, Connecticut, my hometown, we had a collaboration between the university and some artists and residents using cool paints. Not the only city to do this, of course, but creating beautiful spaces with murals and cooling paints on walls and roofs to try to begin to address in a passive way some of the indoor heat, while so enabling this safe passage. And then I wanted to give two examples that tie to some of what Gary White was talking about this morning on some financial innovations, I'll say, and this came from the work that we did with Resilient Cities Network and the survey last year. So in Ahmedabad, India, the Self-Employed Women's Association used microinsurance to protect the income of women who were unable to work, and I think that's an incredible way. And we're not talking about $1 million loans; we're talking about really microinsurance, but protecting women and women's wages at those moments when they're most needed by creating collective action. And a second example is, and there are many, I'm looking at a list, so I'm being selective here, but another example is, for example, the opportunity not just to build trees, to plant trees, very, very important for carbon capture, for shade, and for heat reduction. But a place like Lagos Nairobi, Kenya, that is incentivizing building owners with tax breaks and tax assistance to develop and implement these nature-based solutions. So it goes a step further.
And so that would be things like rooftops with vegetation on top, which, I mean, is such a simple step. It doesn't require the billions and trillions that we've been hearing about all day, but could be replicated quite easily in many parts of the world. Dimple, I mean, you have this kind of bird's eye view which you can create using modelling and data. Talk us through what you can see and how you can then use that for solutions.
Yeah, absolutely. As I sort of mentioned before, through modelling and heat mapping, we can start looking at how we prioritise solutions in cities. So we did a bit of work for the Greater London Authority last year, where we mapped heat across cities, but then also layered that with socioeconomic vulnerability. So we know that older adults, younger children, people under income deprivation, they're going to be more vulnerable to heat. And then we also mapped vulnerability of buildings, so what buildings are not actually cooling down. You take those 3 layers and you get a different kind of hotspot map, you get a risk map, and then you can start zooming in and thinking about solutions. So the other thing that we can do is then test out things quite rapidly. So we took an example of an area in Fitzrovia in central London, just up the road, where it is pretty hot. And we thought about how can we layer different solutions together and what difference can that make? So we really maximize things like greenery, adding as much green cover as we can, putting in trees, cool roofs, all of the things mentioned, as well as adding moisture, so irrigation. What difference does that make? So we tested that for the 2022 heat wave where we were getting 40 degrees. And we were starting to see sort of 2 to 3 degrees reduction in temperature. That might not seem like a lot, but when you're in the middle of a heat wave, every degree, every half a degree makes a massive difference. So we know that we can maximize those passive measures and we can do sort of interventions at scale, and we've got tools to sort of measure that. The other side of the scale is looking at buildings and overheating, as I've mentioned before. So again, we can start testing, what interventions are going to make a difference. So we did a bit of work with roof over our heads for informal settlements in India. And this was really looking at sort of settlements that have materials that retain heat, so things like corrugated, metal, all of those things, where inside it could be much hotter than outside. So what are the quick solutions that we can test? So one thing that worked really well was putting in a layer of plastic bottles in between the sort of corrugated roof materials. And you can find that there could be a 12-degree difference between the outside and the inside. We can model this, measure it, and then we can pilot it. So it's kind of different solutions at different scales. Lina, you mentioned sort of different pillars, but I think we need to think about layering solutions, thinking about urban scale measures as well as building scale measures, and then thinking about context as well. What works in one country and one climate is not going to work somewhere else. So we may be able to plant loads of trees in the UK, but that might not be the solution in parts of Africa or Asia, where it's something else. It's a cool roof, or it's sort of using sort of more local planting in nature. So yeah, all of those things, testing can bring us to the right solution.
Francesca, you also get that overview at a continent level. What have you seen that you can describe to us that cities do to get on the front foot here?
Yeah, I was listening to that, and I was very happy to hear examples like the Paris project on schoolyards and so on. And I think that there is a lot of super inspiring stuff that is going on in Europe at the city level. So they are really, real life laboratories where things are happening. But there is an element that I believe we can and we should use more in a way competently when we are advocating, and it is that the huge benefit that we are getting is, of course, and certainly in terms of what we want to achieve is preparing and making cities more resilient to heat waves. But so many of these interventions, greening the cities, providing a higher quality green space that is adapted and it is well thought through so that we are not creating some of the risks. We don't want to have more allergies. We don't want to create unintentionally breeding ground for vectors. We have to know how to do that correctly. But when you do that, you have so many health benefits for your city. And then I think that as a policymaker, this is something that we really need to help them to take forward and to advocate. There are contexts where now the sea world, the climate world is becoming a little bit controversial. But, an intervention that makes a city greener, it makes a city healthier because of the heat, but also because you create opportunities for people to be more physically active, because we are reaching out to communities that otherwise would be more deprived. So it is very important that we learn how to make our narratives more effective. And going back to the first point that was brought up by Lina about the governance, I think there are also there inspiring examples at the city levels, where, for example, in Athens, they have established the chief heat officer as like a coordinating function within the local government to bring together all those elements from the early warnings down to the response of health systems. And you will allow me one last moment to remind everybody that although WHO is not, we are observers in the climate convention, but last year at COP29, we issued a special report. And indeed, the special report that was published with the support of more than 300 scientists and 100 organizations. So it was not done, you know, back of the envelope in my kitchen. We have identified very important, very effective actions, many of them acting at the level of the cities. And these are implementing heat health warning systems, electrifying primary healthcare facilities with the solar power, improving water and sanitation infrastructure, transitioning to clean household energy, and reforming fossil fuel pricing. And what is estimated is that if we were able to move along this path, we would save more than 2 million lives per year. And for every dollar invested in one of these, $4 of return for that investment would be accrued. And many of these, perhaps with the exception of reforming fossil fuel pricing that normally requires, you know, national, if not international action, everything else is also available. And there are beautiful examples of actions taking place in cities.
Thank you. Peter, your work is rooted here in London, so right down to the micro. I mean, we've spent decades in the UK and elsewhere. Insulate your houses. And in fact, in some places they have those communal heating systems and they don't even have control over them. All that was done to try and save the planet, which we might not have done particularly well on so far. But now we're too hot. What have you seen, and how do you enable cities like London to do both and to do it equitably, to make sure everyone is taken along?
Yeah, really great questions. I didn't think we were going to get to district boiler systems. I'll try not to bore on with those. I mean, just a couple of things we draw up. One is that equity point, recognizing that those who are most impacted often those on lower incomes, those with multiple long-term conditions, and recognizing that even at the kind of London scale, we've got much more kind of localized those who are being affected distinctly worse. And it will often be people who are kind of least well positioned to then respond to the situation they find themselves in. They've often kind of contributed less. They may not drive a car. They may be living in a smaller home as well. And so we see that very much in our place. We're based in Lambeth and Southwark, so both in the south of London. And there you have really intense inequalities. You can have people who live streets apart who have as much as a decade difference in life expectancy. We funded a project working with the Bureau of Investigative Journalism, where on a pilot basis we tracked some of the indoor temperatures of homes within Southwark. And this wasn't in 2022, so it wasn't that it was the hottest summer, but over the period of the 40 homes, found that all of those were 25 degrees or over during the period. A quarter of them were over 30 degrees, and in two of the household, we had people who were hospitalized ultimately by the temperatures in their home. And off the back of that project, kind of one of the big things we've done, almost drawing on some of the other examples from the panel, one is working with councils in our place, so including Lambeth, to map to kind of map a bit along the lines of what you said, create a heat inequality index, so you could see that combination of both kind of who are people living in housing that's more likely to get particularly hot, where do we see the kind of highest levels of deprivation, and tracking that data together, then looking at like, you know, what's likely to be the best way to get messages to them, get early action that they can actually do at that very localized level. For us, one of the striking things is that lots of the techniques that even kind of well-meaning, intending councils do not reach into the level of like some of those estates that you'll see around the boroughs in which we serve. And so what we've been piloting, the work's not finished yet, is working with not just the council, but also with local voluntary sector organisations who are more likely to know the kind of older residents that can't otherwise be reached, who are likely to be able to kind of translate relevant messages. And some of the, and like lots of what we've been talking about in this session and throughout the day will be about major, big, long-term solutions. At that really localized level, some of the things we're talking about are immediate practical steps to mitigate the here and now. So that can be about kind of energy vouchers for household, that can be distribution of fans, that can be like getting people blackout blinds and doing other immediate steps that mean that those who are, unable to navigate like changes they need to make can in the short term, through kind of trusted networks and organizations, get a more immediate response. And fast forward a couple months, we'll get more of the results from this pilot. We're hoping we can work with more councils up and down the country to get some of these approaches tested, because it really is those who are the kind of furthest from health equity that are likely to be the most exposed to climate inequity as well.
Before we go to questions, a quick 30 seconds from each of the panel members, because there's always something that they wish they'd said and they've been thinking over in their heads. We could just go along the line. Jeanette, do you want to start?
So many things. I think being a professor of public health, I have to come back to a word that's been said throughout the day so far already, which is prevention. We do know what works. We know we have many solutions, some traditional, some more innovative. We need to act boldly, and we need to act now. And I think also we need to be aspirational. We need to really be thinking about what does the healthiest, most resilient cities look like, and how do we create them collectively? How do we co-create them to be equitable, to be fair, to be resilient to both climate and health? And gratefully, I think there are many of us working collaboratively on this effort, and we'll continue to share out these solutions.
Lina.
We talked about the urgency. I think a problem is that there is that cities and city leaders don't have always the agency to act. And they need, especially in the connection between the impacts of heat with health and the health outcomes, they need better data. They need better evidence, and they need also models and business models in order to make the case of why to prioritize X investment over Z. We actually initiated last week a new partnership with BUPA and RACET under the SMI initiative, together with Yale and MOD Economics, in bringing, first of all, these city leaders that are pioneering in their cities together, creating the necessary evidence, the right data, and the right frameworks to help them, again, being able to prioritize their investments, because in the end, everything comes down to the finance. So how do you make the case that, yes, this is the investments I need to make, because it will save me X amount of dollars in the health systems, but also add also the social and economic aspects.
Thank you. All about the money. Actually, I think you were going to come to that point as well, Dimple.
Yeah, a little bit, but just building on what these guys have said is that, coming from the world of data modeling analytics, what's really important is communication, and I think communication is key. I live in a world of jargon, and that doesn't work for everyone. And it is about a collaborative effort and bringing everyone to the table. So from the public sector, city governments, through to the community, but also the private sector. So the economics, how do we communicate that? And that's the important thing, is that we are speaking in a language that everyone can understand and that can incentivize action across the board.
Peter.
Equity would be the kind of big takeaway that I would push. If we don't have solutions that work for those who are most at risk. We don't really have solutions. So recognizing that solutions need to be built with equity in mind, and in that I think there's a hugely important role for like how do you leverage the broader social infrastructure of places, working with local charities, working with community groups to make sure that solutions actually reach those that they need to.
And Francesca?
Yes, I think that there is a shared sense of impatience here because we have the feeling and the understanding that it is by now not so much a matter of evidence of the impacts. Of course, we need the better data, more data, particularly in places for which we do not have those data, not yet for them. But the point is, how can we move the action at the scale and pace that is needed? So from my perspective, I would see two main, prongs for this. One is about the political will and resolve at international, national, and local level. And for that, in our region, the WHO European region is just convened an independent pan-European Commission on Climate and Health, which is led by the former Prime Minister of Iceland and supported by Sarah Andy Hines from the London School as our chief scientist, to help taking the messages and formulating recommendations for policymakers to accelerate action. But at the same time, we also need to empower and to support the vast community of professionals, practitioners, and civil servants, because they are the ones who, at the end of the day, will be pushing and turning the cranks of the governance machinery.
So
and for that, I'm very happy to see a growing number of countries coming together. Here in Europe, we have 12 of them under the leadership of Ireland, coming together in a partnership for health sector climate action. And it is really a community of practice that is learning from each other. So we need, it is not either or, it must happen at the same time. Political resolve and empowerment of the community who will take forward the change.
Empowering, thank you. Please put your hand up for questions, even if you want to name the next heat wave as well. We start here at the front. Sorry, the lights make it.
Thank you. I've probably learned more from this panel than most. It's been a wonderful discussion. I have a question because there's a Best Buy that I haven't heard mentioned all day long. And I'll have to caveat by saying I'm not representing the organization that I've worked with and have pioneered decarbonizing healthcare or trained 70 countries on how to get started. I'm not representing my role on the governing body of the ATTACH, which represents 90 countries and 80 technical partners. I'm not representing the Lancet Commission, on which I'm a commissioner for the sustainable healthcare. This is from me. Why is it, if we're interested in prevention as a Best Buy thinking philosophy, social determinants, equity, resource use, and the inequities around that, why is it that no one has mentioned closing the gap for demand to and access for contraceptives? That's my question. Thank you.
Very interesting. And if we take another... thank you.
Okay, thank you for this nice discussion. So how would you reconcile the concept of a green city with the risk of vector-borne diseases? Because we know that mosquitoes thrive in this green and humid environment. So that's a challenge. So I would like to hear your views on that. Thanks.
Okay, let's take those two to start with. The contraception point, I know, Jeanette, you've worked in sort of maternal health and so on, so maybe you want to pick up on that to begin with.
I haven't thought about it in this context, but I think it's an excellent question. And when we think about population growth and density, of course, we're talking about demands on all systems, city systems, healthcare systems, and so on. I think it's I haven't seen that connection made so explicitly. I think it's something that we can and should do more. I think it ties to public education and to public health systems and the healthcare system. I'll just say briefly in terms of pregnancy, which in some ways is the counterpoint to contraception, is we know that heat, of course, affects safe pregnancy and has a terrible risk for preterm birth, which affects health along the lifespan. So I think dealing both in the perinatal period with contraception and preconception all the way through would provide, as you say, a lot of bang for buck. So thank you for raising that.
Francesca, on the vector-borne diseases, I know that you've mentioned that in some of your coverage.
Yes, and I think that this is a very important, aspect that one needs to consider. And it is a part of how we do the right planning for the right places in the right way. So it is not just any greening that will work. It is very important to be fully aware of what are the geographical, the climatic conditions of the places where interventions are taking place. And it is equally very important to be mindful of the need to have very robust surveillance systems when it comes to vector-borne diseases, because now we are seeing them appearing here in Europe. It was reminded before, in places where they were unknown. So are our health systems prepared to conduct the appropriate surveillance? And whenever we are implementing green projects, are they sustainable in the long run? Because this is one of the projects. Very often cities fight with the limited budgets. And of course, there is a big danger into start developing a green area if that green area will not be tended and will not be properly maintained, ensuring that it is delivering what is meant to deliver, which is a health, well-being, a beautiful city, a thriving city, rather than disbanding.
Thank you. Judging from the number of hands that went up, I think they're going to be bombarded afterwards. I'm sorry we've run out of time. So thank you to all. I hope you're now buzzing with ideas.